Hi, everyone. My name is Fedor Panov. I'm one of the neurosurgeons at Mount Sinai Health, and today I would like to discuss with you diffusion tractography guided focused ultrasound treatment for tremor control. My disclosures are not related or relevant to this procedure, and I want to start you off with a patient history. This patient is well known to our team. He's a 65-year-old right-handed male who has tremor-dominant Parkinson's disease. The most distressing symptoms for him through the entirety of this diagnosis has been left-sided hand tremor. It's persistent and has really rendered him unable to perform his activities of daily living. It's very difficult to control because increasing levodopa for him leads to significant dyskinesias or uncontrollable movements. So while his tremor is better, he still has difficulty using that hand. And as some of our other patients, he's significantly anxious and worried about surgical procedures and interventions on the brain. So for several years, he has been refusing surgery to treat these symptoms. So let's go through what are the possible approaches for us to be able to help this patient. Well, the first and the classic approach would be deep brain stimulation, DBS. And that is performed at our center. We do these cases awake with microelectrode recordings. We also do them asleep with MRI guidance. And that is a very good way to potentially get this patient's tremor under control. We would also use diffusion tractography to map out the correct area of the brain to place the lead. But it would require an implant and it would require an open surgery for him. And at our center, as some other centers, these surgeries would be staged. So only a week later, he would be getting his pulse generator. And only a couple of weeks after that, would our neuromodulation team turn the device on and get him the relief for the treatment. Radiofrequency ablation is another way to make a lesion, but this requires a craniotomy, a small opening in the skull. And in the majority of centers, the patients are awake for this procedure as well in the operating room. But instead of advancing a deep brain stimulation lead, we advance the radiofrequency ablation probe. We are sure that we're in the correct spot, and then we activate the probe itself to increase the temperature around that area of the brain and to cause an irreversible lesion in that area to stop the tremor from happening. And that is an approach that has been used for a long time, and lesions have been around at this point for about 70 years. Continuing medical treatment is always an option, but usually these patients have exhausted their medical treatments before they come to the attention of the neurosurgical team. But what I want to focus on today is the high-frequency ultrasound, this novel procedure called HIFU, that is, to me, another and a potentially better way to make a lesion. Again, historically, a very important and good way to treat movement disorders, but now with potentially greater specificity and higher accuracy with patient-specific targeting, and at the same time, completely incisionless. In this kind of a procedure, the patient is in the MRI scanner, and numerous, up to 1,100 small beams of ultrasound are sent through the skin, the skull, and the brain to focus on the target. Each one of those does not significantly affect the brain, but the place where they all intersect is where the temperature will go up and is where the lesion will be created. So high-frequency ultrasound itself is an incisionless procedure. It does require a full head shave at this point, and that is important to discuss with patients early on because that could be a significant reason that they decline the procedure itself. So we address that as one of the first portions of our conversations about HIFU. The patients are awake during the procedure, so testing can be done to decrease the possible side effects and complications of the procedure itself. The procedure is repeatable. If a patient got a good result, but 3 to 6 months later, the symptoms are coming back. It's something that we can do again. And recently, the procedure has been approved for staged bilateral treatment, although a 9-month gap is required between performing the procedure on one side versus the other side. So heading back to our patient, so this is his baseline spiral drawing, which is a classic way that we evaluate essential tremor. And you can see that the 65-year-old can barely keep his pen onto paper. And over here on the right, you can see a stock image of what the setup looks like. It's a fairly futuristic helmet that goes on to the MRI gantry. And the treatment itself happens once the patient gets rolled inside of the MRI scanner to the isocenter. And that's where the ultrasound will be activated. This right here are a couple of photos of the setup at our center. So we have a fully integrated operating room with the MRI scanner itself with appropriate airflow as well as sterility. So we can perform open and minimally invasive as well as now focused ultrasound procedures at our center in this operating room here. But to me, the key, what separates this procedure from what has happened over the past 30 years or so, is the ability to target with patient-specific tractography and the ability then to verify those results with partial treatment and then complete treatment as we go through the procedure. So in this video, you guys can see the ablation target in purple, and that is the dentata rubrothalamic tract that is medial and anterior to the green fibers, which are the sensory fibers, and also to the red fibers, which are the motor fibers, and those stay lateral to our intended lesion. You can see here when we take away the purple, you can see the lesion that has just been created, and that is the white. And you can see how the fibers from the sensory tracts are staying just posterior and lateral to it, and how the fibers of the motor tracts are staying just lateral to our lesion. This is the way that we're able to keep the procedure as safe as possible. And we have confirmation live during the procedure before the procedure is finished. And obviously, we're also examining the patient during this for appropriate diminution of their tremors. So to look at that, let's again look at the baseline spiral drawing. During the treatment itself, we're able to partially deactivate the area for a time by applying enough energy through the high-frequency ultrasound to increase the temperature in the area to about 52 degrees centigrade. And what we think that does is it causes a reversible lesion in the area that allows us to test if there are any complications to the treatment and if the tremor response is significant. And here you guys can see that his spiral is already improving with this partial treatment. That gives the patient and the team the confidence to then increase the energy and increase the temperature at target to 59 degrees centigrade. And you guys can see the result of his spiral here, which is significantly better than pre-op. In recovery, immediately following the procedure, the patient said, "I can pick up change from the floor for the first time in years with my left hand. I would like to be the ambassador for this procedure. And when can we do the other side?" Discharge for him went smoothly. He was observed for a couple hours after the procedure itself, and no pain medication was needed after he was discharged. The 5-month follow-up for him is as follows. He's doing well with no return of the tremor and no side effects. He's adamant that he now wants his right hand, which is the one with less symptoms, treated as soon as possible. And the team is scheduling a contralateral procedure for him to aid that right hand after the 9-month waiting period. So in conclusion, I just want to stress that this novel incisionless outpatient procedure may be of great help to some patients who are well selected, but at the same time hesitant to pursue some of the other well-established and known, but more invasive approaches for treatment of movement disorders. Thank you so much for listening.